Hi, this is Dr. Nishal, and in this video, we're going to be talking about diabetes type 2, insulin resistance, and how to manage it naturally. So, in insulin resistance, basically the cells are unable to interact with the insulin. And the reason for this is that there are certain trace minerals that tend to be deficient in most people, which are responsible for um, cellular metabolism and for carrying out the functions of the various metabolic functions within the cell, including the metabolism of sugar. Now, the main minerals that are responsible for this are chromium and vanadium. These enhance they regulate as well as enhance sugar metabolism by improving the way insulin works. So the first thing you'd want to do is supplement these two minerals. Now, of course, you'd have to wonder, why are you deficient in these? And the reason most of us are deficient in these is because our foods no longer contain the nutrition that they should have, because due to genetic modification, growing in soil that is stripped of minerals, stripped of nutrients, as a result, we don't get the proper nutrition. We may get the macronutrients, but we don't get the micronutrients, and we certainly don't get the trace minerals that we need. So you would want to supplement with chromium and vanadium. There are certain foods that tend to be rich in these, but as I said, it would be better to go with the supplement. But I'll tell you the foods in any case. There's two main foods that contain both chromium and vanadium, and that would be black pepper and mushrooms. These are quite rich in these trace minerals. Now you can go ahead and Google other foods that are rich in them, but it's best to go with the supplement. Now the next thing that enhances cellular metabolism is shilajit. Shilajit is a herbal mineral supplement used in Ayurvedic medicine. It's basically an exudate found in the Himalayas. It contains several trace minerals and fulvic acid. Now, shilajit has been well researched, and well, I wouldn't say well researched, but it has been researched to quite an extent. And in one study, it actually outperformed metformin, which is one of the most common drugs given in high blood sugar in diabetes type 2. What shilajit does is it enhances cellular metabolism in two ways. One, it enhances mitochondrial function. The exact way in which it does it, the exact mechanism behind how that occurs, isn't entirely understood. However, it does contain all the trace minerals, almost every trace mineral you can think of. And because it's so dense in nutrients, it can be considered by certain standards to be a superfood. And which is one of the main reasons why it's so good for anti-aging. It's actually very effective in anti-aging and reversing several of the symptoms of aging and premature aging as well. So these would be the two main things I would recommend for getting rid of insulin resistance. Now, there are other things as well that can be done. Fasting. Intermittent fasting reduces insulin resistance. It improves insulin sensitivity. There are a couple of foods that bring down blood glucose levels. Bitter melon, also known as bitter gourd, cinnamon, specifically Ceylon cinnamon, limes, lemon, green tea, and always, as always, you should monitor your blood sugar levels when taking these things. We don't want them to get too low as well. So yeah, those are a few tips of mine for reducing blood sugar, reducing insulin resistance, and treating diabetes type 2. If you'd like to get in contact with me, you can go to my website, drnishal.com, DOCTORNISHAL.com, and I'll see you in the next video.